Here are 3 essential tips to help you improve your foot drop. The first tip, which isn't so obvious, is to use an orthosis. But doctor, I don't want to use an orthosis, because if I use one, it means I'll be like this for the rest of my life. Guys, don't be prejudiced against orthoses. The orthosis is not meant to protect your foot for the rest of your life. It's something used temporarily to help you walk better, to prevent you from falling, and to keep your heel from becoming shortened until you undergo a more definitive treatment or even recover. Understand this, we have 2 patients. Both patients are going to have tendon transfer surgery to improve their dropped foot. One of them uses the orthosis 24 hours a day until the day of the surgery, and the other patient doesn't use it, keeps his foot unsupported, and goes about his life until the procedure. Which patient do you think I'll be able to lift the foot higher to tie the tendon? And will have a much better result. Of course, the patient who used the orthosis and stretched the heel will have a much better outcome. And that patient who walked around without the orthosis and ended up with a shortened heel will have a worse result. And this brings us to tip number 2 for you to get a better result, which is stretching the heel. The orthosis passively stretches your heel for many hours during the day. However, active and more intense stretching is what will give you greater ankle range of motion so that you can achieve a better result in case you undergo a tendon transfer. Or even if you happen to regain strength spontaneously and then your ankle allows you to make the movement. You have no idea how many patients I've seen who eventually regained strength without surgery, but because they didn't properly take care of their heel with stretching and the use of an orthosis, they ended up needing surgery even though they had strength. They had the strength to lift, but their heel was so stiff that they couldn't achieve enough range of motion to take a proper step. And the third piece of advice I'm going to give you is this. If it's severe, have the surgery. So patients with severe nerve injuries, for example, with a fibular nerve avulsion, or patients who undergo electromyography and show no reinnervation after many months since the accident, they end up wanting to wait. They wait 6 months, a year, 2 years. And what happens then? The heel ends up shortening, the ankle develops a deformity, and the muscles undergo significant atrophy. This means that the outcome of a very late surgery is worse. What I tell my patients most often is, the more severe the injury, the sooner the surgery should be performed. Among the advantages we have by performing surgery earlier in a more severe injury is the following. The patient needs to recover from the accident, so by doing the surgery, they can use that recovery time to also recover from the procedure we performed. Another thing is, the physical therapy time they will do after the injury will also help in the recovery from the surgery they had. And finally, the patient doesn't give up on the treatment. It might seem counterintuitive, right, to give up on a treatment. You're watching this video because you haven't given up on your treatment yet. However, when we have a case where the patient has already had knee surgery, has already undergone nerve decompression surgery, and is still doing physical therapy after 2 years, the chances of the patient not wanting to undergo a third surgery, like a tendon transfer for example, are very high. Therefore, I understand the following. Shortening the treatment in this case can make a huge difference in your final outcome. Therefore, the more severe your injury is, the greater the chance that you will need surgery. If you enjoyed this video and noticed that there isn't much information about drop foot syndrome on the internet, then help me create more content by liking this video and following our channel.